Hello there, welcome back. Today we'll be looking at the differences between primary and secondary wound healing. Now we'll start by explaining the different types of wound healing. We have primary intention, secondary intention, and tertiary intention. In primary intention, the edges of the wound are brought together and there is minimal scar formation. In secondary intention, there is sufficient tissue lost, thus the surface cannot be brought together and the wound heals by granulation. While in tertiary intention, there is delayed closure of wound because of the risk of infection, contamination, or poor circulation. Now, the mnemonic that will help us remember the differences between primary and secondary intention is NICE. N for number of dead cells, I for inflammation, C for contraction, E for edges, S for scarring. Primary intention. N number of dead cells. In primary intention, there is limited number of dead cells. While in secondary intention, there is massive loss of tissue, so there is increased number of dead cells. For I, inflammation. In primary intention, there is little inflammation, while in secondary intention, there is more intense inflammation. C for contraction. In primary intention, there is no wound contraction, while in secondary intention, there is wound contraction. E for edges. In primary intention, the edges are brought together. We have opposed edges, while in secondary intention, we have separated edges. S for scarring. In primary intention, there is minimal scarring. In secondary intention, scarring is predominant. So there is increased scarring and there is large amount of granulation tissue that leads to scar formation. Thanks for watching.